So today I'm going to assess the abdomen. So in assessing the abdomen, the basic concept is that abdominal assessment is evaluation of the abdomen, liver, and bladder involving 4 methods of examination, which are the inspection, auscultation, palpation, and percussion. So the main objectives here is to obtain an accurate nursing health history of the client's abdomen and related functions. Second is to determine for any deviations or abnormalities of the abdomen. And lastly is that it's to be able to formulate nursing diagnosis, collaborative problem, and referral. So in preparation, we're going to assemble equipment, which are the examining light, tape measure, to be metal or non-stretchable cloth, water-soluble skin marking pencil, and stethoscope. And then we're going to introduce ourselves and verify the client's identity, explain to the client what we are going to do and why is it necessary and how the client can cooperate. Then we're going to perform hand hygiene and observe other appropriate infection control procedures. Then provide for client privacy. Then we're going to determine the client's history of the following: incidents of abdominal pain such as location, onset, sequence, and chronology, its quality or the description, its frequency, associated, and the symptoms. Bowel habits, incidents of constipation or diarrhea, change in appetite, food intolerances, foods ingested in the last 24 hours, specific signs and symptoms, previous problems, and treatment. But first, we're going to wear gloves. Let's just assume that I am also wearing in my left hand. So we're going to assist the client to a supine position with the arms placed comfortably at the sides. Then we're going to place small pillows beneath the knees and the head. Then we're going to expose only the client's abdomen from the chest line to the pubic area. This is to reduce tension in the abdominal muscles and also to avoid chilling and shivering. This can tense the abdominal muscles. So in inspection of the abdomen, we're going to inspect the abdomen for skin integrity. Then, inspect the abdomen for contour and symmetry. We're going to observe the abdominal contour while standing at the client's side when the client is in supine. Then, ask the client to take a deep breath and hold it. So, sir, can you take a deep breath? Then, assess the symmetry of contour while standing at the foot of the bed. If distension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. Then, we're going to observe the abdominal movements associated with respiration, peristalsis, or aortic pulsations. Then, observe the vascular pattern. Then, in auscultation of the abdomen. Auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction rubs. Then in percussion of the abdomen, we're going to percuss several areas in each of the 4 quadrants. Use a systematic patterns. We're going to percuss. Begin in the lower left quadrant. Then, in the lower right quadrant. Then, at the upper right quadrant. And lastly, in the upper left quadrant. This is to determine presence of tympany and dullness. It also to determine its size. So, in percussion of the liver, we're going to begin percussing the abdomen along the right mid-clavicular line. starting below the level of the umbilicus. Then, mark the point of change with a felt tip pen. Then, we're going to percuss downward along the right mid-clavicular line, starting above the nipple. Move downward until percussion notes change from normal lung resonance to dullness, usually at the 5th to 7th intercostal space. And again, mark the point of change with a felt tip pen. Estimate the lever size by measuring the distance between the two marks. This indicates the lower border of the lever and also indicates the upper border of the lever. So in palpation of the abdomen, we're going to perform light palpation first. Systematically explore all 4 quadrants. Then, perform deep palpation over all the 4 quadrants. This is to detect areas of tenderness and or muscle guarding. So in palpation of the liver, we're going to palpate the liver, and this is to detect enlargement and tenderness. So there are 2 methods. So the first method is the standard palpation. So in standard palpation, then we're going to place the patient in supine position. Then we're going to stand at the right side of the client. Then we're going to place our left hand under the client's back at the approximate location of the liver. Then place your right hand slightly below the mark at the liver's upper border that you made during the percussion. Then, as the patient inhales, deeply, gently press in and up on the abdomen until the liver brushes under your right hand. So sir, can you take a deep breath? Then note any tenderness. So the method 2 is the hooking the liver. So we're going to stand next to the patient's right shoulder, facing his feet. Then place our hands side by side and hook your fingertips over the right costal margin below the lower mark of dullness. Then ask the patient to take a deep breath as you push your fingertips. So take a deep breath, sir. So if the liver is palpable, you may feel its edge as it slides down in the abdomen as he breathes in. Now, in palpation of the bladder, we're going to palpate the area above the pubic symphysis. This indicates possible urinary retention. Then, we're going to document findings in the client record. So now, in assessing the musculoskeletal system, the basic concept here is that assessing the musculoskeletal system is the evaluation of the strength, tone, size, and symmetry of the muscle development and for presence of tremors. So the basic objective here is to check for any divisions of the musculoskeletal system. Second is to acquire information and accurate nursing history of the muscles, bones, and joints of the patient. And lastly, to be able to formulate nursing diagnosis, collaborative problem, and referral. So in preparation, we're going to assemble the equipment, which is the goniometer only. Then, introduce yourselves and verify the client's identity. Explain to the client what we are going to do and why is it important, and how the client can cooperate. Then, we're going to perform hand hygiene and observe other appropriate infection control procedures. Then, provide for client's privacy. So, we're going to inquire if the client has any history of the following: muscle pain, such as onset, location, character, associated phenomena, and aggravating and alleviating factors. Any limitations to movement or inability to perform activities of daily living, previous sports injuries, and any loss of function without pain. So in assessing the muscles, we're going to inspect the muscles for size. Then compare each muscles on one side of the body to the same muscle on the other side. For any apparent discrepancies, measure the muscles with a tape. Then we're going to inspect the muscles and tendons for contractures. Then, inspect the muscles for tremors. Inspect any tremors of the hands and arms by having the client hold arms out in front of the body. We're going to palpate muscles at rest to determine muscle tonicity. Then, palpate muscles while the client is active and passive for flaccidity, spasticity, and smoothness of movement. Then, test the muscle strength. We're going to compare the right side with the left side. Inspect the skeleton for normal structure and deformities. Then, in the bones, we're going to palpate the bones to locate any areas of edema or tenderness. Then, in assessing the joints, we're going to inspect the joint for swelling. So, palpate each joint for tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. Then, inspect the joint for swelling. Ask the client to move selected body parts. Kindly move your arm. If available, use a goniometer to measure the angle of the joint in degrees. Since we don't have goniometer, let's just assume this ruler is a goniometer. Then, we're going to document findings in the client record.